I'm Stuart Hoffman. I'm a retired professional, been surfing my whole life and enjoy the outdoors and everything I can to just, again, be active and get around. So mobility has always been part of my life since I was a child. After so many years of surfing and enjoying the ocean, I didn't realize that I was starting to experience pain that was building up in my leg, my knee. And I thought it was just, as I'm getting older, my muscles were not cooperating with me. I wasn't really sure why it was doing that. And it became such a severe pain and problem in my life that I couldn't surf anymore. I couldn't do the things that I normally did without the pain, and it started to shut me down. I started to feel a little depressed over that. I couldn't join my friends or in something that was important to me. So I searched for physicians that would help me to get the answers to find out what was causing the problem. I was given a referral to consult with a hip specialist, Dr. Patton.
I'm Dr. David Patton. I'm an orthopedic surgeon here at West Boca Medical Center who specializes in robotic-assisted total joint replacement of the hip and knee. Well, Stuart had all the indications. He had severe arthritis, he had loss of function, poor quality of life secondary to pain, and of course, he wasn't able to do one of the things he loves the most, which is surfing.
So when I went to Dr. Patton for his consultation, he identified my left hip was the problem and that there was nothing he could do other than surgery and replacement of the hip to alleviate all that pain. So Dr. Patton was very educational in explaining why the robotic-assisted surgery for hip replacement was so important, because it provided a more precise and more accurate procedure that also eliminated any excessive trauma to the muscles and to the joint and anything else involved in that surgery. It made sense to me.
The robot takes the precision and accuracy up to a degree that we were never able to obtain before. With the robot, we're able to dial you in to within a millimeter or two almost every time.
The only question I had for Dr. Patton at that point was, when can you get me in for surgery? And the surgery that I had at West Boca Medical Center was fantastic.
A hip replacement, probably the first 4 weeks, is the toughest part. The robotic approach and the muscle sparing approach allows them to return even sooner because we have so much more a higher comfort level that they won't dislocate the hip joint, which was a very common problem in the past.
My recovery is coming along really well. I'm back to surfing without pain. My flexibility has really increased where I can do the things that I was always doing before. So I'm getting back to my full lifestyle and it feels great. I'm glad I had the surgery because now I can keep living my life without regrets and I really enjoy all the things that I've always been doing.